We're coming to our last speakers. Also banks to realize that more and more people want to invest their money in a responsible way, that they have values they believe in, and they want to invest in a different way. Impact investment is the word of the hour. It's the key word, although we heard before in the panel from Peter Wolfley that it can't be underestimated, that it's also a lot of work. One bank that is leading in this field is the LGT. Impact investment is something they do since many, many years. And today, Oliver Karius will explain to you a little bit what the risks are, what the success chances are, and what the challenges are.
Thank you. Good afternoon, ladies and gentlemen. It's a great pleasure to be here, and I'm really delighted that this forum has come together to really focus on impact investing and also to discuss new models for collaboration. I'm a partner at LGT Impact. We've been doing impact investing and venture philanthropy since 2007. We were set up by Prince Max, and some of you have heard of him yesterday, and also his passion to really use capital for positive impact in the world. I want to start by setting the scene, and we just recently saw this. If we asked ourselves, we can do this, and by that I mean sending a man into space, and some people decide to send Teslas into space. This image, sort of, for me, incorporates a kind of intention. If we as humans really get together, really use our resources and have a positive intent, everything is possible. So if we take this and we can send somebody into space in a really hostile environment, then ask the question, what's happening here? And by here, I mean on the left, you see that we're living beyond the kind of carrying capacity of a lot of the environment on this planet. So this represents sort of the environmental impact, negative impact that we have. And on the right, you see that there's this income disparity going on, and there are billions of people living today that don't have access to essential goods and services. Now, we essentially want to fix that problem, and we fix that problem by solutions, by investing into scalable solutions that are sustainable and that have high impact. Now, the solutions that we look for at LGT Venture Philanthropy and LGT Impact should essentially reduce the kind of environmental impact, and you see that on the left, the kind of red spheres, that's outside the carrying capacity, and inside that donut, this is a donut economic model, that was presented by Kate Raworth a couple of months ago. Inside that, you see the quality of life. So where it's red inside, people don't have access to education, healthcare, essential goods and services. And we need to find an economic model that really allows us to live in that kind of green donut rim. And I think we should and are actively looking for solutions that allow us to live in that kind of inner greener circle. And I think it's a very powerful image to sort of bear in mind when you look at impact investment opportunities. And in addition to that, we also want to actively contribute to the SDGs. And this is a breakdown of the SDGs by ESG, so by environment, social, and governance, and it's all held together by the partnership approach. So when we set out, we really want to support organizations in emerging markets that provide essential goods and services that have high impact. And we've seen with the demographic changes around the world that there are, as I said, new markets opening up, particularly in emerging markets, that are totally underserved. The traditional model of philanthropy is not equipped to really support those and finance those solutions. And in a lot of cases, the private sector is really not interested yet because it's too risky. And governments really can't provide those essential goods and services. So there's a very interesting and dynamic market opening up. Quick snapshot where the capital comes from. On the left-hand side is the kind of philanthropic motivated capital, and as you see, it's around 300 billion. And on the right-hand side, we see in the mainstream markets, integrating environmental and social criteria is really driving this sphere of impact investing. And there's much stronger integration of ESG factors, impact factors into the investment process. And what's really interesting is where these two spheres meet, where you have philanthropy, but where you also have the financial markets looking to innovate around new financial systems and solutions as well, like social impact bonds, for instance. And what's interesting as well is the people that we work with and that are in our sort of broader environment There are philanthropists who come from philanthropy but now sort of say, okay, I want to integrate that into my impact investments. And traditional investors saying, well, hang on, we need to integrate environmental and social criteria and really drive positive impact investments. And of course, we've seen a tremendous growth as well. Our mission is to improve quality of life of less advantaged people. We follow a number of key principles. We do direct investments. So we're very hands-on. We work with our global team on the ground. We work directly with these enterprises. We work in growth markets in Brazil, East Africa, India, Southeast Asia, and China. And we have a number of key sectors that we're focusing. No surprise there. It's education, it's health, it's agriculture, it's energy. These are a lot of the key sectors that we focus on. And on the funding side, our experience over the last 10 years has been that it's important to provide the funding, but writing a check is one thing. Really working with young enterprises that have been set up with founders that want to grow, you have to provide knowledge, know-how, helps on the system side, on the organizational side, and this is really building organizations. And just providing the funding falls short of the actual needs of those enterprises to be successful. We heard a lot over the last 2 days about the kind of income pyramid. This is a schematic representation about sort of how much money do people actually have that they can spend every day. And with the venture philanthropy approach, we focus on the bottom half of this pyramid. So this is people that are living on less than $10 a day, down right to the poor. And with impact investing, we are focusing in the middle market because we've seen that there are people who are able to avail $10, $15, $20 a day for healthcare, for education. And that's a really important data point because you can start building businesses around that. Now, the businesses need to look different because, of course, these are tiny, tiny amounts, but it actually opens up a whole opportunity there of an underserved market that we are trying to cover with our two approaches. We've invested over 125 million into 62 organizations, and 2 years ago our portfolio reached around 5 million direct beneficiaries. And of course, through our work, we also contribute to the SDGs, and then we started to do a much closer mapping actually of our sectors and the work that we do with the SDGs as a really important communication frame, because we want to work with partners who are with government and other players who are also aligning around the SDGs. And I think that's a really interesting opportunity for going into 2030, which didn't exist before, because the SDGs are a wonderful sort of leveler of different players coming together and working together. We implement our work through our team. We're over 40 people. Prince Max spoke here yesterday. In the last 10 years, he's never missed one board meeting or one investment committee. So it's really close to his heart and, of course, to the family as well. And is very actively engaged in our work. This is a snapshot of the portfolio organizations, and I will pick out two specifically that I want to share with you today about the learnings of doing impact investing and philanthropy, what worked, what didn't work, or what the kind of challenges are as you sort of look to scale these enterprises. We've done a lot. The smallest ticket was around 50,000. The largest investment that we've done is 20 million. We do sort of early stage, Series A, Series B type investments, and we also have a whole number of portfolio organizations that are non-profits that have a scalable model that provide, for instance, work with HIV pregnant mothers in Africa. We don't make a huge difference between is it a for-profit model, is it not a for-profit model. We really come with a solutions approach. We look at the problem in the areas that we want to support, and then we look at the solution to that problem, and only then do we then we look at what kind of organization is implementing that solution. Because otherwise I find, and I've been listening to the discussion over the last 2 days, we really focus on, it becomes, is it a for-profit model, non-profit model, grants, investment. If we just put that nomenclature aside and really think about what's the right type of financing for this organization, then suddenly it opens up a much more creative way of financing and supporting these ventures. So let's get concrete. I'd like to take you to Brazil. I don't know how many of you have actually visited a state hospital in Brazil. But Brazil has roughly around 200 million, a population of 200 million, and 150 million have to rely on the public sector for their healthcare. Now, if you go to a public hospital in Brazil, they are crowded, they are stretched to the limit. If you want to have a diagnosis, it takes sometimes 300 days to actually get a doctor's appointment. If you want to need an operation, it can take over a year to get an operation. So And in Brazil, it's interesting. You have the public healthcare system, and you have the private healthcare system, which really caters to the affluent, the 5-star kind of private clinics. But what happens? Who provides basic healthcare provision for that underserved middle market? And Dr. Consulta was set up in 2011 by a number of entrepreneurs who all used to work for Ambev. Ambev is the largest beverage company. These were young folks, very smart, very driven, and they said, look, there's a big need in the market. There are folks who are willing to pay for high-quality, low-cost education, but those clinics don't exist. So let's go out and find those clinics or found those clinics. And in the first couple of years, it was quite interesting because it was more real estate play. They had a couple of clinics which didn't work, and they didn't work because they were at the wrong location. It's like when you open up Starbucks, you have to open up your Starbucks where the people are and where they go. So Dr. Consulta in the beginning, they identified great locations, but they weren't the right locations. So they had to go through that learning. And we invested when they had 2 clinics. We now scale this up to over 30. This is Sao Paulo. This is peri-urban Sao Paulo. So this is a population that can spend the average ticket for treatment is around $35. And they provide sort of walk-in services, high quality, super clean, very efficient, and very efficient treatment. And it takes 55 minutes on average. So you walk in, you get registered, a triage, you get sent to the doctors immediately, you get treated. And they're now expanding the clinics, but they're also expanding the whole range of different services, maternal services, lab services, digital imaging, etc. And they're now looking to scale out beyond Sao Paulo. So this is an example of, really providing a new form of healthcare at a low price point, but high quality, because the people really want and deserve and need high quality health support. Some numbers here, just how have they grown? And last year they had over 700,000 unique patient interactions. And I think what's really interesting is the patient satisfaction level here, because it says 95%. So 95% of the patients really appreciate and like the treatment that they got. What we found is that sometimes with NGO models, it's very much donor-driven, and it's not built around the actual customer, but around the beneficiary. Now, in a Dr. Consulta model, it's actually flipped on its head, and they say they will go out of business if they don't provide the service at that price point to that patient, and that patient would feel, yes, I got the right kind of support, and I will go back. So it's also an interesting way of really aligning your business model towards the beneficiaries or the customers that you want to serve. What was interesting with Dr. Consulta as well is now we're looking to scale into Brazil and into Rio, and across Brazil. And now the challenges are, where do we get the funding? Because in order to grow from 40 clinics to 100 clinics, these are really big ticket investment items now, and we're starting to work with institutional investors and larger investors that can really fund a model like that. Good. Coming to the second example, which is a new form of a public-private partnership. Really quite excited about this model because it's fairly new, so I want to share with you also some of the key insights just after the first year of its operation. And with this, we go to Liberia. And Liberia is one of the poorest countries in this world, on this planet. And they've had an incredible civil war, which really destroyed the whole education system and a lot of the schools that you find. And they have an incredible young population. So 40% of the population is under 15. 40%. 60% is under 25. So you have a population that is young, that is really eager, that wants to learn. And the Liberian government, because of civil war, etc., the Liberian government has realized that they will never be able to provide education at a high quality to those people themselves, because they rely a lot on kind of international donor funding, and they don't have the experience to suddenly start running these schools in far-flung places in Liberia. And we've also have some really, really bad educational outcomes there. I mean, that one stat, 1 in 5 girls in the 5th grade can read a single sentence, only 1 girl in the 5th grade. So if we don't intervene at that level with a really early stage, and that's why education is so important, we'll have a large population growing up without any education, and looking for jobs later on will be nearly impossible. So the Liberian government has been actually pretty gutsy, and they said, okay, we can't do it, so let's work with private operators. And they invited, it's a new public-private partnership model, they invited 8 public operators to say, look, you come in, you run our schools, we pay the teachers, right? And we, as a government, you are accountable to us. You need to measure your educational outcomes. We want to see data, we want to see transparency. And it's a new way of actually working together, and we decided to invest into that model to really support and learn what is possible working with private operators and government, and how do you align those different incentives, and how do you focus on the educational outcomes to be totally results oriented. This is the ambition level of the government. They would like to reach 20% of schools by 2019. We started with 93 schools a year ago. We're now looking to expand to 200 schools with these 8 operators to grow across Liberia. And this is a snapshot of Liberia. On the left, you see that first year, the kind of clustering that happened. And then the government said, okay, we will start with this clustering on the left, but we're also going to run in parallel a randomized controlled trial to really see what are the educational outcomes of those schools. Are we really better? Are more teachers teaching? Are more children really getting the education that they deserve? And now in the second year that we're in, they're now starting to expand across the whole of Liberia. But even if this model is successful, we're still only reaching 20% of all the schools. Now, what's interesting with this model is that the cost that you have when you start is around $100 per pupil. And over time, as the scale goes up, the costs come down. And the aim of this model is to be then at $50 per child per year, which is the normal cost that an African government spends in the public education system. So the government said, look, we need to start and pay for these operators. They need to implement their curriculum and do all these things. So we're willing to take that step to $100, but then over time, our vision is to come down to $50. But where do we get the funding from? And this is on the right-hand side, quite an interesting model. In the beginning, they had to go out to philanthropists. So there are 7 foundations who came together in that first phase, in that first year, say, yeah, we're willing to take the risk. And again, here, I feel that grants are actually sometimes the scarcest capital because you can take maximum risk with it. It's not soft funding at all. So we came in year 1 with those 7 other foundations. And then over time, you start crowding in other funders. And the ultimate vision is that because it's results-based, that the Liberian government is able to then launch a results-based financing instrument, which then can attract private sector capital in. So it's at the stage using all the different types of financing to get this model working. And it's been a lot of fun to see and learn about this model, what works. The results have been really impressive after the first year. It says at the top there that the outcomes have increased across the board, across all the implementers. There are, of course, challenges about how do you scale this out across Liberia, etc. So new research is to be made. But what I found really interesting here is totally data-driven, right? So even after 1 year, you know exactly where you stand, whether your assumptions were right, whether the private operators are really delivering a better system, and that allows you then to tweak and improve the model. And in our experience, the most successful enterprises that we work with are extremely data-driven, right? Because you need the data to make the right kind of decisions. So where do we go from here? I want to share a couple of thoughts why I think foundations should really play a more catalytic role in development, and this is also the theme of this conference. One is, I think, foundations, and in our case, we really have scale written into the models that we work, and I also see that at the Hilti Foundation, scalability is such an important aspect. This is not about funding one school here, but this is really funding new models to really drive positive development. Second is not a lot of foundations are using 100% of their capital to achieve positive impact. And I think this is a huge white elephant in the room because there are foundations that are extremely well endowed, but they're not thinking about how can I use the rest of my capital that I'm not using for my program to really align it towards mission-related investment. So I think there's been some really good studies coming out in the last 2 years about what can be done, but I think there's more work to be done, and it can be really catalytic. And the third part I want to share is actually a study that came out last Friday from the OECD, which I'm very grateful for. Excuse me. And the OECD looked at the topic of private philanthropy for development. So what can private philanthropy do to support development? And a couple of stats here is that 24 billion, it represents around 5% of ODA, comes from private philanthropists. So it's not a big amount, but I think it's a really important amount. The majority flows to Africa. The majority comes right now from the States, and then you have the UK and Switzerland and the Netherlands. And then, of course, a couple of other countries. And this is a bit skewed because of the Bill and Melinda Gates Foundation, of their huge size. And the majority is actually used for health as a theme. And what they're doing with this study is now to really encourage private philanthropists to seek a much stronger engagement with the development actors and to see where are the synergies. How can we work together? How can we bring the capital, the know-how, what we have to the table so that we can really contribute to development and reaching the SDGs? Some of the recommendations that come out: collaboration and closer coordination with ODA providers, not surprising. The second point was mentioned in the previous panel. This is about enabling environments. So governments in developing countries could create a much better level playing field for philanthropists and other social sector organizations to work together from a status perspective. There are new ways of engaging together. And the last point is on data. And I wasn't aware of some of these new platforms here. These are big databases that we will start using as well to upload our data so that the OECD can actually start compiling impact data and the themes that we are working on. And then I think it would be, what will be helpful to then see the kind of where the collaboration areas really exist and where foundations could come in and maybe plug a certain gap or provide some funding in a development area that is previously unfunded. Julia Ballandina mentioned this. I think this is a great opportunity for us. This is a funding gap to actually reach the SDGs. And I think it just presents itself as a wonderful opportunity. And we've been actively looking for those models like a Dr. Consulta on the impact investing side or PSL, for instance, in Liberia, to really drive new ways or new business models to drive positive impact. And I'd like to close with an adapted quote from Angus Deaton, who said, "Growth is the best cure of poverty." I would like to expand that and say the right kind of growth is the best cure for poverty. And by that, I mean the integration of social and environmental criteria and development. And this is a picture from one of our portfolio companies, M-Copa, and we had a helping hand from Obana, who happened to walk past. This wasn't staged. So I think this also just represents to us really working together in a more collaborative spirit. And more importantly, as we look to fulfill the SDGs, really these new forms of partnerships that are absolutely essential. Thank you very much.
Thank you very much for this. Are there any questions? Seems everything is clear.
Good.
Now we have a question over here, and one, I think, over there. Exactly. Good.
So again, Lillian Fur from the EDEC Group. A question regarding the Liberia project. Why Liberia?
Well, it was the government of Liberia who really took a step back and said, look, if we want to provide the education, the Liberian government took a very proactive stance and said we need to engage in new models. Who exactly in the Liberian government, if that's your question, who initiated it was the education minister. But what do you mean by your question? Why Liberia?
I mean, for LGT, I think for me, when you do something in a country, it has to be kind of strategic.
Yes.
So LGT Bank, I'm not sure if you are in Liberia, I don't think so.
No, we're not.
So, for example, is there a vision to enter the African market and specifically Liberia? Or what is the purpose that you're funding this project in Liberia?
One is that we said we want to follow the good models. And if you're too regionally specific, you can miss out. And what we really liked about the PSL model is that for us, it's a question around endgame. If this is successful, we can scale this out across other governments, right? So That's our sort of end game that we're aiming for. This has nothing to do about the kind of core business where LGT Bank is. And this was partly driven when we were set up. Prince Max really said that he wanted to focus on emerging markets because the gulf between rich and poor is increasing, and the environmental challenges in those countries are so massive. So let's engage there and let's find the entrepreneurs in those countries.
Okay, thank you.
And we had one more question over here, right?
Yeah. First, congratulations. I think that's a very interesting program in Liberia and innovative. And it's great to hear that you see the need for stronger partnerships between foundations and governments, and also linking with social business. I would be curious to hear what role do you see for civil society in this connection? Or you don't see the...
No, I think civil society plays a really important role in terms of driving for that change. I mean, we see this in some of the countries that we work in that are enabled through tech platforms and mobile phones, etc. I mean, civil society organizations need to be strengthened, and a lot of the drivers come from them for that positive change. We have not worked in our portfolio companies because we take a very focused approach. We have not worked with civil society organizations. We said we really want to work with these entrepreneurs, and that's what we do. But I fully understand where you're coming from in terms of your experience as well about working with civil society organizations to build that change. What we've seen with the models is that whether it's healthcare, whether it's education, at some point it needs to be an outreach, and it needs to be much more inclusive around community. So what we're doing going forward is we said in community healthcare models, for instance. That's a way to go to provide basic healthcare provision, particularly in poorer countries or developing countries. And that only works by involving civil society, right? But we said the agent that we want to support has to be, in this case, an entrepreneur, an organization that is driving a model.
Thank you very much.
I also have a question over here about Liberia. The quality of the teachers. I mean, you talked about the cost at the beginning, which are higher. But the quality of the teachers, you mentioned that the education was down after the war. So how did you get the teachers up to speed in the end, so that they really teach the right things the right way?
That's an excellent question. The teachers are actually, I think if we go back to the baseline before this program started, there were a lot of teachers, but they were completely disempowered. They didn't have the right curriculum. They weren't paid properly. There was a delay of getting paid even by the government by 10 months. They were overworked, etc. So a lot of the program really from these private operators focused on empowering the teachers, making sure they get paid on time, giving them the right kind of curriculum in time for what needs to happen. So they feel much more sort of air under their wings to sort of deliver and to teach. So focusing actually on teacher efficiency is really, really important. And before the baseline, the government didn't even know how many teachers were in a certain school, right? So just by integrating with new technology, suddenly you have full visibility into the school. You say, actually, why do we have 3 directors in that school? There should only be 1, right? So it really fostered this whole change through being really transparent, and a lot of the teachers have come back and are now teaching, of course, with this new curriculum.
Thank you.
Okay.
I think no more questions. Oliver, Karius, thank you very much.
Thank you very much
for this interesting insight. Thank you.
Thank you.
What is that?